Hello. Here I'll talk about the procedures of male fertility preservation. What is fertility preservation? It is the process of saving or protecting sperm so that a person can use them to have biological children in the future. Having children may not be your priority right now, but it can be important for some of you later. In our center, we offer fertility preservation service to those whose future fertility might be affected by treatment for cancer or other medical conditions. That includes surgery, chemotherapy, or radiotherapy. I will go through the frequently asked questions on fertility preservation. Cancer treatment can reduce and damage sperm in the testes. Following cancer treatment, some men may not be able to produce sperm. The ability to have children may be affected. Freezing sperm is an option for men, including adolescent boys, to preserve fertility. Many can have their own children with the help of fertility treatment in the future if they freeze their semen before receiving cancer treatment. The semen sample should be preferably frozen before the start of the cancer treatment. However, your cancer treatment should not be delayed because of this, and do let us know if that is a concern. If you are referred to our clinic, you will meet our fertility specialist who will ask you some questions about your medical conditions and related issues. If you decide to freeze sperm, you will need to sign a consent form. If you are younger than 18 years old, your parents will need to sign the consent form together. It is best to avoid ejaculation for at least 2 days, but not more than 7 days before the sperm banking procedure. You can masturbate in a private room, and sometimes we may ask you to produce 2 samples a few days apart to increase the number of sperms that can be stored. The whole procedure can be finished within an afternoon session. Your sperms are then checked under the microscope for number, motility, and appearance, and the sperms are stored in vials in a liquid nitrogen tank, as shown below. If you are worried that you cannot produce a semen sample, you can always talk to a member of the team caring for you. If you cannot achieve this, don't worry. You can always make another appointment, and we can further discuss alternative ways of collecting your sperm. You can perform a sperm test after your cancer treatment completes. Some men may still have sperm after cancer treatment and may never need to use the frozen semen. If you need to use the frozen sperm to make babies in the future, you must be legally married before fertility treatment. You and your wife can be referred to a fertility clinic when you have plans for babies. The stored sperm can be injected into your wife's womb in a procedure called intrauterine insemination, or they could be fertilized with your wife's egg to make embryos, and the embryos transferred into the womb in a procedure called in-vitro fertilization. In intrauterine insemination, the sperms are washed and then injected into your wife's womb. In in-vitro fertilization, or IVF, your wife's eggs are collected and fertilized with your sperm in the lab to make embryos. The embryo is then transferred back into the womb. There are limits as to how long you can store your frozen sperm in the laboratory. At a maximum, you can store the frozen sperm until you are 55 years old or for 10 years, whichever is later. You can also specify an age limit lower than 55 years or a maximum period of shorter than 10 years. The contract is renewed every 2 years, and the frozen sperm will be discarded if you fail to renew the contract. You can inform the center anytime if you do not want to continue with the storage of frozen sperm and would like to terminate the storage contract. We offer a public male fertility preservation service at Queen Mary Hospital. There are certain selection criteria, as stated here, for you to be eligible to be seen as a public patient. If you do not fulfill these criteria, but would still like to consider sperm freezing, you can be seen as a private patient. Even as a public patient for fertility preservation, there are some charges for sperm storage. To arrange sperm freezing, you can download a referral form from our website, ask your cancer doctor to refer you to us, and fax the referral letter to us. We will usually arrange an appointment within 1 week. For more information, you can visit our website where there is a section on fertility preservation. You can also visit our pages on Facebook and Instagram and our YouTube channel for more information. If you have any questions that are not addressed here, we can always